Hello and welcome to the Oral Apothecary Podcast, authentic chat about medicines, pharmacy and healthcare in the UK.
Pharmacists Jamie, Gimmo and SDC take on topical and controversial stories but keep it edgy yet light-hearted.
Podcasts share their career-defining drug, song and book and also share their joyful patient stories.
Welcome to the Oral Apothecary Podcast. My name is Jamie Hayes. For this episode we're joined by Professor Claire Thompson. Claire is a multi-award-winning scientist, entrepreneur, non-exec director and philanthropist with more than 20 years' experience in the pharmaceutical industry. We'll welcome Claire in a moment as she shares a drug for the Oral Apothecary Formulary, her career anthem and recommends a book for our library. Our micro-discussion this week looks at a piece from the Guardian newspaper on when did everything become awesome and amazing. So we're exploring things that annoy us in the world of medicines and healthcare. It's got an end-of-series feel to proceedings. Let me welcome my two fellow apothecaries. SDC is in Bournemouth and Gimmo is in Cardiff. Welcome both. What's news?
Evening.
Evening. Not much for me, really, because since we last met, I've been on holiday, so you don't want to hear about my holidays.
No, we don't. You're right.
I went to the Green Man, and as you know, we tried to get into the Green Man, didn't we, to do a live show, but they knocked us back after some initial interest. So I did boycott the science tent as a result. You'd be glad to know.
Oh, I was going to ask you what was in there, and is there anything that we can learn for taking the Oral Apothecary on the road?
No, I didn't go in there. So yeah, and then a week in Crete, which was nice because with COVID and everything, it's nice to get away with the family for the first time. So that was good. And then Tuesday went to, in Wales, they launch a maternity and neonate safety strategy. So I went to the launch of that. And that was really interesting because even though it's not necessarily medicines, although there are some medicines themes in there, it touched a lot on the themes of it, touched a lot on what we've talked about, putting the patients or the family and the mums at the front and centre, and how people react to incidents, prevent incidents and stuff. And so it was a really good conference. So watch the space on this. It could be a really interesting piece of work, the sort of all Wales maternity and neonate safety strategy.
And Gimmo, didn't you say that someone approached you? I used the word approach in the men's toilet and asked you if you were Gimmo.
Yeah, so someone came up to me and said, are you Gimmo? And I said, yeah. And yeah, he was a fan of the show. So that was nice. It was Farmer Tom, I think he goes by on Twitter. So he's a listener. He likes the show. We had a good chat about what he likes about it, and I think he's a maternity and neonate pharmacist as well. So yeah, so cheers, Tom. Thanks for saying that. So it was one of those. We were having a chat in the toilet, and then I said, "Should we chat outside when we finish?"
Yeah, I think I've been there. That's always a little bit awkward, isn't it?
Yeah.
I mean, I can't contain this for too much longer. What gave it away in the toilets that you were Gimmo? Please tell me you've got a T-shirt that says I am Gimmo, because otherwise, I mean...
It's the voice. He was obviously...
singing. It was great. There's great acoustics in here.
I talked to myself in the toilet.
Very good. Well, listen, I was also on holiday. It was nice to be off for a week. But I've got two quick things for the listener. Given that this is our last episode, and probably our last episode until 2023. So, we've always liked to mention other podcasts and books that we've come across. So the first is a podcast that actually Mahendra Patel put me onto, which is What Your GP Doesn't Tell You. And there have been 3 episodes. It's only just started, actually, by a BBC producer and medical journalist called Liz Tucker. And so she started that. And there are 3 episodes. The first one was fascinating. It was about that story that broke a few weeks ago about SSRIs and whether or not the depression is actually caused by low serotonin. And listeners will know that we've talked about that. And she was quite on with the Professor Joanne Moncrief, and at the end she even said to her, because she is a psychiatrist, and she said to her, do you think there's any chance that you would ever take an antidepressant? So she was quite forward. The second one was about female medical science and the lack of it, and with a journalist from Australia who's looking into this subject. And that was fascinating. I know that we've talked about the biases before, gender bias. And the last one is Professor Carol Sikora, and this is in 2 pieces. He's this guru around cancer. He's been working in cancer for about 40 years. And the episode is called How to Be a Savvy Cancer Patient. And basically he talks about how to beat the system, essentially, if I'm honest. Anyway, that's interesting. And the second thing is a book that Jamie put me onto via another podcast, which is called Alchemy: The Surprising Power of Ideas That Don't Make Sense, by a chap called Rory Sutherland. You might know, I think he writes in the economist. He's basically in advertising, and he's part of the Ogilvy legend. Well, David Ogilvy is dead now, but he's one of the co-chairmen now of Ogilvy Advertising Agency. And so as sort of systemized type people that pharmacy professionals are, this goes against the grain of all of that. So it's encouraging that people need to think differently. And I think maybe our guests might be in this group. But it's just a fascinating book. And so just one little soundbite. He said, take the difference between why do people go to a GP versus why do they go to a dentist? In that he said often, and this is dead true, they go to a GP to seek reassurance. You don't go to a dentist to seek reassurance. You go because you're actually in some pain and that you need to go. And I know sometimes GPs are for the other as well. But also, I've got to give you this, Jamie, you're going to love this if you haven't read it. So David Ogilvy, who's now dead, who's also from advertising, and he quotes this in the book. He said this: people don't think what they feel, they don't say what they think, and they don't do what they say. And that's what they think about when it comes to thinking differently in advertising. So those are my two things. Jamie, what have you been up to?
Well, I'm glad that you've discovered Rory Sutherland, because I have read Alchemy and I follow his work. I'm reading that at the moment, which is Rory Sutherland's Transport for Humans. And there's, again, you may think it's way off topic, but it's all about how we behave. And for us in healthcare, when people are waiting, there's a great piece in the book where he describes about improving the wait. So rather than, when people are waiting in waiting rooms or waiting in clinics, and our attempt is always to be quicker, well, actually, sometimes you don't need to be quicker. If you can improve the quality of the wait for people, then it doesn't have to be that time pressured. So there's lots for us. Again, it's all coming back to behavioural science and lots for us to learn. So, yeah, Rory Sutherland, big thumbs up. I went to the Welsh Pharmacy Awards last night, bumped into a couple of our oral apothecary alumni. Professor Dareth James and John Devereux were both there. It was a very pleasant evening. Big shout out to Jenny Pugh-Jones, who got the Special Recognition Award from the Royal Pharmaceutical Society last night. So well done to Jenny, well deserved. Okay, well, you've already heard from her a little bit, because let's welcome our guest. It's our great pleasure to welcome Professor Claire Thompson to the Oral Apothecary. In addition to Claire's earlier intro, Claire is also a Chief Exec of Agility Life Sciences. She's an entrepreneur in residence at University of Cambridge. She's a former footballer and has launched and fully funded the Girls in Football Teams grants, which supports girls and women's teams across the UK. Welcome, Claire.
Thank you. My goodness.
Thank you for joining us.
That grand title and the length of it, I think we've run out of time. Thanks, chaps. It's lovely to be here.
Great. What's the one thing that you would like to share with our Oral Apothecary global audience, Claire?
Well, I think the world is kind of still on fire. It has been on fire now for a couple of years. And I'm a big fan of not letting a crisis go to waste. So I'd love to talk about what we've learned about how we make medicines in terms of how we can do things quicker, more efficiently, because the pressure's on us now. Everybody expects us to make vaccines in 12 months and make simple molecule medicines even faster than that, because they're not difficult. So, what are we going to do about this? And also, what have we learned about ourselves and how we work with people and what's important to us? So what can we carry out of this crisis and carry it forward, and making the process of making medicine more efficient, getting them to patients much more quickly? And how do we work with people? Big believer that people work with people. They're the most important things in our lives. They're the most important things in our businesses. We bloody well need to look after each other.
Well said. My friend, actually, who's also in advertising, used to say to me, people do business with people.
Absolutely.
Never forget that.
No, I mean, this isn't, we're not a pharmaceutical business. We're not a medicines business. That's not what this industry is. It's not research, it's not science. It's kind of what we do, but we are a people business. There are probably 30,000 pharmaceutical scientists in mainland Europe, but it's like a village. Everybody knows everybody else. So it's so important that we're authentic people. We get on with each other and we get the job done. It's so much easier then.
What is it that you do then, Claire? In a couple of sentences for us.
Yeah, so we work with mostly small biotechs. They come to us with these badly behaved molecules, they're all badly behaved, and we turn them into formulations that give them the best chance of success in preclinical studies and then be fast-tracked onto clinic and commercial. So it's a fast, future-proof formulations.
And is that your term, badly behaved molecules?
I haven't heard anybody that disputes it.
that.
Yeah. Mm-hmm.
That's a BBC sitcom, isn't it?
Yeah, well, Steve will try and patent it in a minute, so...
Yeah.
Yeah, they're all badly behaved. The easy stuff's been done. The molecules are getting, less soluble, less permeable, bigger and bigger and bigger. So they're all a headache.
So Claire, are you working in the vaccine space, or are you saying that what you've all had to learn from the COVID situation is that now everybody's saying, well, if you can do that for vaccines, why can't you do what we want even quicker? Is that what you're meaning?
Yeah, I think from a public perception, and even I think a government perception, this has been done quickly. So why can't it be done more quickly in the future? But the eyes of the world are upon us. Everybody is now interested in what we do as pharmaceutical scientists. They're interested in medicines. And up until a couple of years ago, we were the second most hated industry in the world after oil and gas. And those buggers are bleeding us dry. I might have to turn the light off halfway through this podcast. So we need to use this attention for good. And one of my other bugbears is about, as scientists, we are taught to speak in tongues. We speak in a different language. We use a lot of jargon. We need to get rid of that. We need to make our messaging simple. We need to make our messaging memorable, palatable to who we're talking to. So if somebody goes, oh, what do you do? Tell me more about this. What do you think about this vaccine? So I had builders in here over lockdown. They built my studio that you can see. And now, for the listeners, I have a massive shoe rack behind me. It should be a bookcase, but no, down with that sort of thing. I've got my shoes on that behind me. I'm a shoe addict.
Whoa, wait a minute. You're not the first of our guests, are you? So if I remember rightly, Claire Howard, Lely Obo, and Sam Quay.
All alumni.
They are. They're all part of my shoe crew, and I'll tell you more about the shoe crew in a minute. When I had the builders here, they said, oh, I'm not sure about this vaccine. What's it all about? I don't think I should have it. And I was explaining to them that this isn't a brand new thing that has just been dreamt up and now they're going to put it into humans. This is like, and I was offering them a biscuit. Builders love the biscuits. I said, so if you think of the outside of the vaccine is like this box of biscuits, and it's been around for years, and it's been very well tried and tested, and there's loads of other vaccines that have used this biscuit box. The new thing is the little biscuit that is inside it. It's the only thing that's changed is the little biscuit, and that's a fragment of the virus, and that's not going to hurt you. So everything in there is safe for you to take. Would you like a biscuit? Yeah, I'd like a biscuit. Are you going to get the vaccine? Yeah, I think I probably will. And it's, for me, it's thinking about who is it that you're talking to, what's the message that you want to get across to them, and how are you going to make that meaningful and memorable for them. So hopefully he's been able to go down the gym or down the pub afterwards and go, so the vaccine's just like a box of biscuits.
Has the builder finished his work, though?
Yeah, they did finish.
How many biscuits did you go through?
Look, I don't mind. If I can convince them that it's safe to have their vaccines, they can have all the biscuits. They can even have the decent hobnobs. Yeah, they did finish, but the bookshelf, shoe shelf behind me that you can see, it's got scaffolding planks on it. They left those planks in my garden for too long. So I rehomed them.
Very good.
And now they have pride of place. Yeah.
So I mean, I'm interested to know then what, I suppose, so that the parallel in the NHS is during COVID, there was a rapidity to service transformation and change that's not been seen before, and things were done much quicker than normal. Services were set up. We had the vaccine service set up. We had, lots of reorganisation, changing how we do things. And I suppose there was a feeling amongst everyone that, we can harness this for good and it will continue afterwards. But I'm not sure it has. I think once that external pressure is lifted, I think things are different. There's no doubt about it. But I would say that entrepreneurial approach to, or innovative approach to doing things has probably drifted away now. I mean, partly because the NHS is dealing with a huge backlog now, and there's a lot of pressure. But so I wonder, is that what you're feeling, or are you still feeling that same sense of innovation and excitement that was happening during COVID?
I mean, as you said earlier, I'm I'm still a footballer at heart. I can't run around like I did when I was 18. In my head, I'm 28. I'm absolutely not 28. It's 28 plus a bit of VAT and a bit of corporation tax and national insurance on the top. So I always played in defence, which meant that the biggest part of my job was reading the game. So looking 2 steps ahead. If the ball goes there, what are we going to do? If that player then goes there, am I going to go to the ball? Am I going to go to player? So playing football taught me those valuable skills, not just for sport, but for life and for leadership. And I think that really helped me in planning for Brexit and for the pandemic, because I was always scenario planning. I was always disaster planning. So managing multiple campaigns, so trying to get enough drug for a study. The study could be happening in France and we need to get it there in 2 months' time. But China's shut down, and that's where we've got the current manufacturing campaign going on. So what are we going to do? Okay, well, we need parallel campaigns in the hope that one of them delivers for this. So it was always trying to think 2 steps ahead. And if this happens, how are we going to respond to that? And as I said earlier, we work with a lot of small biotechs. The investors still kept their feet to the fire, to the milestones that they had committed to before the pandemic. Those milestones didn't move. So we still had to meet them. Those expectations were still there. Did it make us creative and innovative? Yeah, it did. Was it sustainable? Absolutely not. It was incredibly stressful. But I think it brought teams together to a certain extent, but people burnt out very, very quickly. And I think there was a lot of goodwill lost because maybe that wasn't as visible.
You've given some great analogies already, Claire. I can see that you're a really great communicator, but you've just reminded me of another analogy like that. So do you remember when you're about to go on a big holiday? And remember how hard you work in that sort of 10, maybe 14 days or a week before you go? Well, unbelievably, an ex-boss of mine, Jonathan Cook, I've mentioned it before, he once said to me when I was literally going away, and he said to me, imagine if you could bottle how hard you worked for the last 10 days before a big holiday and work like that all the time. I was like, get lost.
Not a chance. I mean, one of my grandmother's favourite sayings was have to is a wonderful thing. And yeah, if you've got to get stuff done and you're committed to it, whether pride is on the line, your personal, your professional pride, and you need to get stuff done to support your clients, to support your colleagues, to support your teams, you will get that done, but it's absolutely not sustainable. But I mean, there are things that we've learned in the way that we do things and how we can streamline them. But going to that length, Paul, you were saying about the resource in the NHS, it's not that people worked hard, not just that people worked harder at the jobs, it was the resources were moved from other places, which means that other things stopped. And now there's a massive backlog in that area, bigger than there was before. So it's not about returning to normal. Nothing's normal anymore. That was bleak.
We'll leave that in. We'll leave that in. So let's hear a bit more about the football then, and the grant and the gift. So
I retired from playing football when I was 40. I loved the game. I was still relatively fit for 40, but I had a young daughter, and playing football at the weekend pretty much takes up the entirety of the day. I've run a business, didn't really have very much time to be a parent as it was, so going, I'm off to play football on a Sunday. Not great. So in the season that I turned 40, we won the league, we won the cup. I scored 9 goals, including one in the final game of the season, and I thought, I am never going to have another season like this, so I'm going to go out at the top before my body goes, you have had this. But I love it. I would love to be able to run about like a lunatic on the football pitch, and it not to take me 4 days to recover afterwards. So I wanted to continue to support girls and women's football. There's not enough money in the game. Even with the success of the Euros and the money coming in now, there's still not enough. So I wanted to start something that would give girls and women the chance to go out and form the friendships, because playing team sports is all about the camaraderie, the confidence, those colleagues that you take them with you. I've got mates that I'm still really close with that. Played university with in Scotland 25 years ago. We're still thick as thieves, and it's wonderful. The skills that it teaches, not just about, can you do a Cruyff turn? How many flicks can you do around the world? Can you balance the ball on the back of your neck? Can you do, an overhead kick or whatever? It's not just about that.
I'll explain what those things are to STC after the recording.
I know what they are.
I've got a ball behind me. Do you want me to show you some?
I know what
I'd love to see you do a Cruyff turn, Claire.
Oh, okay, deal. I'll show you a Cruyff turn, no problem. So it's not just the technical skills. It's about how you work with people. For me, it's about being a captain, and that's one of the behaviours that we have as a company is be a captain. So understand how people tick. How are you going to get their heads up when you go a goal down? How are you going to keep the momentum going when you're a goal up? How do you get the best out of people? Not necessarily the most. So it's those skills for life and leadership, not just skills for sport. So I wanted to create something which allowed girls to get involved in football. If they go on to play for their country, wonderful. If they go on to be confident girls, fabulous. They go on to positions of leadership and then pass these skills on. Everybody wins. So, I decided a few years ago that as a company, we would donate 2% of our revenues, now not profits, revenues every year to support causes that we were passionate about. So I'd set up the gift grants within that. And the rest of the money, everybody within the company got to pick a charity of their choice. And then we would apportion the money out from there. So the gift grants, like girls and football teams, I love an acronym. So I had to come up with the acronym.
Who doesn't love an acronym? We'll talk about those later.
We were good. So the gift grants were set up to give £500 to the team to go on kit or coaching or equipment. I really didn't mind. And I had to support that girls or women's team. Now it would support them for one season only. So for the first 2 years of that, we had 32 teams that we supported. But my worry, and I've seen this in my playing years, is that it's not sustainable. You give them £500 and it gets them some kit, pays for some coaching, great. But it only takes one coach to go, I can't commit to this anymore because I've, got to work longer hours, or I've got a new job and I'm further away, or a couple of players to move away, and that's it. The whole thing folds. And it's not sustainable. So I was really concerned about all we're doing is, yes, we're giving these clubs some money, but it's not enough to ensure that they're sustainable. So we decided that of the 32 teams of our football family, we would select some for follow-on funding. And from that, we've selected our Super 6 clubs that we will support for the next 5 years. So we're going to give them £2,000 a year. So it's not individual teams, it's the actual club. So from probably under 4 up to maybe my age, walking football. And it's still not an awful lot of money, but we're going to give them £2,000 a year for the next 5 years. And we're also going to support them with their strategy, helping them to access other grants, communication. So I've employed a head of purpose to manage all of the philanthropic pieces that we do. So she, Freya Anglinleaf, rescued her from a life of misery as an accountant to bring her in as a head of purpose. And effectively,
all accountants' lives were misery.
We've saved one. Saved one.
No, I think that's brilliant. I think, no, we're slightly off the medicines topic, but
not a football podcast either, mind, is it?
I got 2 boys and a girl, and the boys are older and they've played football and rugby. And I suppose what you see is they're on, I saw the benefits for the boys of getting involved in rugby, not just from the sports side, but from, as what you said, the team element, the camaraderie. I get a few cheeky pints out of it as well, which is even better. But those opportunities just aren't there for the girls as much. And so I'm really pleased that she started to take up rugby, and she's starting to see all that now as well. And those opportunities for girls to play rugby, even in South Wales, weren't there a couple of years ago. There's two girls rugby clubs in Cardiff, I think, and there's scores of them for boys. So well done. That's fantastic. As a dad of a girl, that's fantastic to hear, because I think we need more of that. Yeah,
for me, it's about legacy. Now, what am I leaving behind? We're people with purpose. I'm a massive believer that people and purpose are much more important than products and profits. Yes, we've got to make products for our clients because, that's the name of our business. That's what they pay us for. Yes, we've got to make profits because people's salaries so they can pay their mortgages and their enormous electric bills. Yes, we've got to keep the lights on in our formulation facility. But if I don't look after the wonderful tribe of people that I have, they are the one and only asset that we have as a business. I love them all dearly. If I don't look after them, I've got nothing. And I don't think we should be just plodding along through life, not thinking about what we're leaving behind, and are we, leaving this world better than we came into it. Well, so purpose is a big thing for me. I think we should do things with purpose and do things on purpose. So the head of purpose role for me was a really important milestone.
It's a bit too deep for our podcast, Claire.
Sorry, just cut that bit out.
Yeah,
that's fine.
We'll rewind it.
That can go in the bloopers reel.
Cut the last 20 minutes out.
No,
Am I going to get 5 minutes? I'm going to introduce myself and it'll be, thanks very much, Claire. Thanks for coming. That's all we've got time for.
Well, listeners to the podcast will know that we often talk about teamwork. So everything that you've said, is very relevant and we would agree with it. But you put it very nicely. And as we all know, teamwork makes the dream work.
I think I've got one on my mug somewhere.
Right, that's my Alan Partridge oral doppelganger coming out once again.
The Oral Apothecary is sponsored by Jamie Hayes Executive Coaching and OneLessPill.com.
Okay, Claire, on to the next part of the podcast. You may or may not be aware that one of the pleasures of coming on as a guest to the Oral Apothecary is to give us 3 things. The first one, this week, or this episode, I'm going to call it the memory pill. So we'd like you to give us your memory pill for the Oral Apothecary formulary. What would you like to offer?
So this is a medicine that means something to me.
Evokes a powerful memory in you.
Yeah, I think it's probably Trexamet, so the migraines medicine, and that's because it's one of only 2 medicines that I've worked on that have actually made it to market.
Oh, very good.
I worked on it in my GSK days. It was quite far down the line. So I think it was either phase 2 or went into phase 3 clinical trials. So that one stands out for me. And also, now I'm a woman of a certain age and I've got blue eyes, so I'm really photosensitive. Those migraines are coming thick and fast, so it's almost like it's coming full circle.
Very good. So actually, for the listener, maybe, because we haven't often got into the pharmaceutical industry, maybe you could just explain because we have quite a few non-healthcare people, what proportion of things, like we understand a little bit, but what proportion of things that you actually start off with actually make it to market? Just give a very, very quick, rough idea for non-healthcare listeners.
Yeah, sure. So at the very early stage of drug discovery, you'll probably start off with about 10,000 molecules, 10,000 ideas of a molecule that might fit the drug target that you're after. Within, say, 18 months, you'll put that through various screens. You bring that down to maybe 100, and of that, 10 will maybe get into a clinical trial, and if you're lucky, one of those will make it to market. So the odds aren't great.
And you've had 2 in a career then?
I know.
Wow.
Should I just retire?
Yeah, just like your football. I think you knew when time.
Right, going out at the top. Yeah, going out at the top. Very good.
I always praise my team wherever I am because they're truly wonderful. Success is not a solo sport. I don't do what I do now on my own. I certainly didn't do any of that on my own. It takes more than a village. It takes enormous teams to pull these things together. So I was a very, very small part of it. But it's lovely to see.
That's the first for us, isn't it? Someone who's picked the drug they invented.
Yeah,
I think you get
a first on that. And let's just be clear. You're talking about sumatriptan, aren't you?
Yes, I am, yeah.
Yeah. So even as the clinician in the room, I'm like, oh my God, she said the name of a drug I don't know. That's a first.
Rapid Googling. Yeah,
exactly
sorry.
Right.
I should have gone with the drug name and not the brand name.
Generic names only on this podcast.
Oh, I do apologise. Shall we start again?
No, but hang on a minute. Trexamate is...
It's sumatriptan and naproxen.
With naproxen, isn't it?
Yeah.
Okay. There you go. Every day's a school day. Right. You can definitely have that.
So did I cheat because I went for 2?
you're
it's a combination.
Again, it's under the radar.
Am I getting away with this because it's the last one in the series?
Yes.
Yeah. Normally, if you know anything about anybody to do with clinical, if you mention a combination product, they normally go apoplectic, because you can't have a combination product because it's too expensive.
And how on earth can you titrate a combination product?
Yes, exactly. But you can definitely have it because you were part of the invention team.
Oh, good. Right,
You've
good.
got it. That's in the Oral Apothecary Library.
If I can't have that one, then the only other one that I've worked on that made it to market was an inhaled drug, and it was also a combination product. So
okay,
you might have had to put me in the library.
Okay.
If you got room 101 in there, get her in.
No, that's a spin-off podcast. Like the Rest is Politics has now got the Rest is Politics question time. Maybe we should have Oral Apothecary 101. Okay, so you can definitely have Treximet as your Oral Apothecary formulary choice. Thank you, Claire. The second thing we're after is a career anthem for the Spotify Oral Apothecary playlist, and it really is on Spotify. What would you like to offer us?
I would, and I've got a backup now. Now that I know that, oh my God, there's criteria. I'm going with Blondie, Heart of Glass.
Oh, great
classy.
I mean, it's got everything. It's got arguably the best intro ever. Great guitar riffs. Great drums, and Debbie Harry, and it's wonderful. I could listen to it at the start of every day. I sang it to myself this morning. Please don't envisage this, but I stepped into the bath this morning. I've just flown in from Belfast. I was staying in a hotel last night. I stepped into the bath. Something really hurt my toe, and appears to be bleeding. What is that? I thought it was like a bit of sand or grit or something like that. Soon turns out it was a shard of glass. I was like, oh, it hurts, but I get to sing Blondie to myself first thing in the morning. Wash my hair. So I am going to put a bid in for Blondie, Heart of Glass, please.
You get an extra point for singing it as well, so well done.
Yeah, very good. That definitely is into the very eclectic. If you've not listened to it, guys, you've got a few months as we're not going to be recording anymore, but do catch up with the Oral Apothecary playlist on Spotify. And the third thing, Claire, is something for the listener for the Oral Apothecary Library. What would you like to offer?
I can go get it. It's just a bit, okay. I might fall over a Labrador. If I swear falling over a Labrador, please beep it out.
Oh, blimey. Just behind you, I've just seen something that's brought me out in palpitations. It says BBC on air.
Yes.
Now, you may not know this, but we're in a bit of a legal dispute, so I'm not even sure if I can carry on with the podcast.
Do I need to turn the light off? It's a BBC On Air light box. I did a little bit of work for the BBC a couple of years ago on BBC Health Truth or Scare. They paid me a tiny bit of money, and I'd seen one of these and thought they were awesome. So I bought it.
Go on then, hold up your choice. I'll take a picture.
My choice is Vaxxers by Sarah Gilbert and Catherine Green. So these are two of the leaders in the University of Oxford vaccine team, and it's a wonderful book. It's got some scientific language in there, but it's certainly, you don't have to be a scientist to understand it. There's a lot of personal perspectives. The chapters flip between being written by Dame Sarah and by Catherine, and it's a personal account, and it's a wonderful book, and I think that for me it was poignant because I took it on the first holiday that we were able to have as a family after the pandemic, and we went to Cape Verde at the end of May this year, and I generally love people. I was very overwhelmed by the number of people in the airport and the number of people around me and everything. It's almost like everybody was like, oh, we're back to normal again now. And for me, it didn't feel normal. I was still feeling quite anxious about being around that many people, having social distance for quite some time, and still, COVID hasn't gone away. And to read this and the fact that these two women and a number of other wonderful people within their team and their colleagues at other institutions took a punt on this. So they heard the news that something was awry. I think it was between Christmas and New Year, and they thought we're going to have to do something with this. We will get the sequence. We're going to have to start this. We can't wait for funding. We can't wait for acknowledgement from within the university or from the funders or from the government. We're going to have to do this. And I cried twice reading this book because of the wonderful things that happens when folk believe in what they're doing and they are incredibly altruistic. Because this is a vaccine that we're never... they weren't doing this to make £1 billion each. It was never going to be that. These are wonderful people. It's a great book, really heartfelt, and I think for me the timing of they have helped all this happen. They have helped to save millions of lives from this horrendous virus, and they're very humble people. I had the fortune of meeting Dame Sarah at an event probably the month before that. I walked into a room, I was going to be talking on the panel. I had no idea that Dame Sarah was on the panel before then. And she just started to walk when I said to her, "Excuse me, Dame Sarah, I've got a really silly question for you." And then she's like, "Okay, go ahead." And I said, "My daughter's 5. She's lived half of her life through this pandemic, and I'm trying to teach her that girls can be anything that they want to be. And I've told her about you and how you've made the vaccine. Please, could I have a photograph with you so that I can show it to her?" And my daughter was due to have her vaccination the next day. And she said, "Yes, of course." So I took a photograph and I sent it home to my wife, and I was telling my daughter that night. And I rang her up and I said, I've just spoken to the scientist that made the vaccine. And she said, "It's fine for you to take it." "Oh yeah, okay, good." And it was just wonderful because, Dame Sarah could have gone, but she didn't. Yeah. Just wonderfully humble people. Great book.
We'll keep that story in, Claire.
Yeah.
That's a great story.
So that definitely makes it into the Oral Apothecary Library. That's Vaxxers by Sarah Gilbert and Catherine Green. Excellent, and a great story as well.
I'd be really interested in that because there's obviously the process, but they must have just been they were under the media spotlight. They must have felt literally the weight of the world on their shoulders, yet tried to behave scientifically and properly as well.
They did, and the media on them all the time. Yeah, it's a great story.
I've already ordered it.
Brilliant. Yeah. I'm glad you didn't tell me, no, you can't have that one. Someone's already had. I didn't have a backup.
You get an extra point if Jamie hasn't read it as well.
I haven't.
He hasn't, so there we go. He's a prolific reader.
He's our bookworm.
Very good.
So I think it's over to me, is it, for the micro discussion? As I think Jamie or Steve said at the beginning, we aren't going to do a paper today. It's our last show, so we just thought we'd have a bit of fun. The article that triggered this, I forwarded this. As we know, Steve goes off on one when someone uses the word amazing, and he's banned it. He's banned it from the show. And so there was an article in the Guardian. When did everything become awesome and amazing? I blame the Americans, and it was written by Adrian Chiles, who's sort of writes a column as a bit of a grumpy old man sometimes.
He does.
And it was just about people overusing the word awesome and amazing for trivial things suddenly become awesome. Everything's amazing. Everything's awesome. We know this annoys Steve, and so we segued nicely into this conversation about what else annoys us. What annoys us in healthcare? What gets on our nerves a bit in medicines? And so what gets on our nerves? Does anyone want to kick us off?
I mean, I like that you picked the topics here for what's going to annoy Steve. What's on the list? What have we done already?
You're already in tune with the podcast, Claire. That should have been the theme.
So I'd like to stick with language, and I've already given my bugbear around jargon. As scientists, that's what we're taught to do. We're taught to talk about features, not about benefits, in very technical terms that only some folk within a certain niche will understand. I want to get rid of that. Why can't we just talk simply and authentically? I think the everything's amazing is not authentic. That's the thing. If you're authentic about it and you absolutely mean it, then yes, definitely go for it. But the people that I want around me are ace. It's not great with my accent, but you're going to stick with me. They're authentic, they're credible, and they're engaging. Those are the people that I work with. Those are the people that I want within my tribe. When I interview people, this is what I'm thinking, as well as, can you align with our behaviours. Give me some examples of when you've been authentic is a question. Brave, creative, being a captain, been inspiring. So what authenticity for me is absolutely key. And I think it's fine to say it's brilliant. I use brilliant a lot as an Irish person. It's part of our lingo as well as a lot of swearing. But if you're authentic, I think that's fine. But another bugbear of mine is kind regards, kindest regards. No, why? What? No.
I agree with you so much. I've written it down on my list.
If you get a kind regards from me, I'm furious. Yes. You'll get a thanks or a take care. Not even a many thanks. Thanks or take care. Take care is my standard one because I'm being authentic. And I think another thing about the pandemic is we've been invited into each other's homes. So we're seeing each other as real people and not just professionals. So can we get rid of this formal nonsense? We should have taken those blinkers down of we are just professional people in suits or dresses or whatever. We're real people. We can be authentic. We can be open with each other. So no more kind regards. No more kindest regards. Best wishes. No. Thanks, take care, or just put your name in there. It's fine.
I just say cheers. I think people have heard me said enough times about the word amazing, and I'm with my dad on that. But I was thinking about this today, and it's a bit like lazy journalism, isn't it? And I think that people become lazy because language evolves, doesn't it? It's cultural. So you just mentioned some words that you use because that's in Northern Ireland words that you use. And I get that. And I'm not blaming the Americans for the use of the amazing. I'm just saying that maybe people become lazy. And so they start following what everybody else says. And I know that people say, well, that's trends or that's fashion. But I just think it's lazy. And there's a massive vocabulary of words that we can use, isn't there? So that's why I like Adrian Charles. When Gimmo sent this, I said, we've got to do this for a lighthearted, because that's exactly what I feel about amazing. Because people say it for the most simple things, and it can't possibly be amazing. But anyway, Jamie, go on. You told me earlier that you had some good medicine.
Well, I don't know. Maybe I've misinterpreted the brief, but here's my list, okay, and I'll come back to them. And so when we miss or hide the story, and so we miss out the human element in what we're talking about, that given the business that we're in, that winds me up. Too much text on slides, that winds me up. Messaging and signage in healthcare waiting rooms.
Yeah.
So especially when you go to a surgery or a pharmacy or a waiting room in a hospital or anywhere where there's tatty bits of paper stuck on the wall, some of them may have been laminated, and so just seeing what mixed messages we give out there. And speakers who go over their allotted time at conferences.
Oh, yeah, so, you have gone off brief, but that's fine. Yeah. We like it all. Yeah, it's good.
And then the main bit was this. So Parkinson's law. I'm going to bring us. Okay. So there's a few things. Parkinson's law. The one that people know about is work expands to fit the time available for completion. Okay. But he's got quite a few of them, and this is from the late 50s, 60s. That good recruitment is a science and an art. The best time to arrive at a party is exactly 45 minutes late. And then his law on triviality, which I see in the healthcare over the years, that committee spends more time discussing small sums of money than large ones. And so
that's so true.
So the number of meetings I've sat in where they're discussing very expensive, hundreds of thousands of pounds technology, where there's only one or two people in the room that know anything about the technology. So everybody's quiet. So that, multi-million pound technology goes through on a nod. And then next on the agenda is the new bike sheds around the back of B4. And because people have been quiet discussing the technology, they now feel as though they should contribute because they haven't said anything for a while. And so the bike shed spends about an hour to go through for a £250 sum. So that's Parkinson's law of triviality.
And then gets pushed to the next meeting because they've run over, because somebody has gone over their allotted time.
There we are. And so can I do my Parkinson's law on committeeology?
Yes.
Okay, because you'll recognise this as well. So a committee is organic rather than mechanical. It's not a structure, but a plant. It takes root and grows. It flowers, wilts and dies, scattering the seed from which other committees will bloom in their turn. The ideal size of a committee appears to be 5. The plant is viable, allowing 2 members to be sick or absent at any time. 5 members are easy to collect, and when collected, can act with competence, secrecy and speed. The number soon rises to 7 or 9. The usual excuse given for this increase is the need for specialist knowledge on more than 4 topics. So, for a committee of 9, policy is made by 3, information is supplied by 2, financial warning by 1, neutral chairman. The other 2 appearing at first glance to be ornamental. Little is known about the function of the 2 silent members, but there is good reason to believe that a committee in this second stage of development might be unworkable without them. Other members come to be admitted, some with a claim to specialist knowledge, but more because of their nuisance value when excluded. Membership rises to 20 and then 22. At this point of development, the whole committee suffers an abrupt chemical organic change. The 5 members who matter will have taken to meeting beforehand. With decisions already reached, little remains for the normal committee to do. All resistance to the committee's expansion comes to an end. It's known with over 20 members present, a meeting begins to change character. Conversations develop separately at either end of the table. Amid the drivel, the useful members present, if there are any, exchange little notes that read, "Lunch with me tomorrow, we'll fix it then." So that's Parkinson's law on committeeology.
Gimmo, did you follow the brief?
Yeah, well, sort of. I mean, mine follows on from that. Do you remember last week when we talked about innovation in primary care and failure demand and stuff, and I used the term sludge, and sort of sludge is that sort of pit of, I think a civil servant told me it once, but it's the sort of pit of bureaucracy that good ideas and things slip into and die. And so I think the NHS is quite bad at this. So bureaucracy around appointing posts or new ideas or innovation. I've just seen, I mean, I'm not one of these people who moans about red tape because for the sake of it, because you need some governance and that's really important. But it's crushing in the NHS. It really is sometimes. The sort of the amount of bureaucracy and the amount of form filling and it's become normalised. Is people are just so used to filling in multiple forms for something. I see so many clinicians spending so much time filling in stuff when most of that stuff isn't needed. And so sludge was one of them. That's the sort of non-medicines-y one. I was going to mention too, sorry for mentioning a pharmacy issue, because I know we're not a pharmacy podcast, but I saw something on Twitter that annoyed me the other day, which is, every day. But it was emergency supply from community pharmacy.
That was on my list.
So we've been talking about this for years, the interpretation of the rules around emergency supply. And so to avoid baffling people who don't know anything about it, there are rules and regulations around what you can and can't do if someone's forgotten their prescription but needs their medicine. And so often in pharmacy, we deny people that supply and send them back to their GPs. And so the humanity of that situation is gone. It's a misinterpretation of the law, and it's been going on for 20 or 30 years. And it's just one of those things that really winds me up. And I don't know why it winds me up so much, but it does. And in this case, it was the thought of someone on holiday who probably went into their pharmacy, I don't know, for an inhaler or something, and didn't get it. And so it just wound me up. So there you go. And the last one is lookalikes. So something else I saw on Twitter that annoyed me was a bag of, I think it was potassium chloride and a bag of paracetamol infusion that both looked exactly the same. And I thought, again, we've been talking about this for 20, 30 years and we're still doing it. So sound like lookalike drugs for people who don't know, but it's still happening. So we just haven't, such a simple thing to fix, you'd think, and it's still happening. So sorry, I got him into rant mode there. But
no, that's all right.
That was 3 things that really do annoy me.
Well, I'll tell you what then. I picked up on the acronym thing that was mentioned earlier. And I got to tell you, so I work in Dorset, right? And so Bournemouth and Poole have come together to create one organisation. 2 hospitals have become one. And so they've always had Bournemouth Intermediate Care Services, otherwise known as BICS, and Poole Intermediate Care Services, otherwise known as PICS. And I keep saying to them, well, surely you're going to become Dorset Intermediate Care Services, but they're not. But I so wish that they would. But anyway, that's acronyms in the NHS, but sometimes they're funny. And the other thing, and this is real, this only today, 2 patients, I love it. We talked about drug names before, some of them how we hate, but some of them are just so funny. So a patient said to me today that they've been taking Sienna for a few days because their bowels were troubling them, i.e. Senna. And the one I liked most today was somebody who's got a thyroid problem. And they said, oh, yeah, I take carbimarsol. I was like, what? She said, and they meant carbimazole. But she said, "Oh, I've been on it for 30 years, and I've always called it carbimarsoles."
Well, we don't make it easy, do we?
No, we don't. Sienna sounds quite a nice laxative, to be honest, doesn't it?
Lovely. Yeah, there should be a rebrand there.
Have you got any more, Claire?
Well, I've got a funny acronym in.
Are you sure you can say
I can't. Yeah, I don't know. I'll go with one. I've got a funny acronym from growing up. After the Good Friday Agreement in Northern Ireland, they changed the Royal Ulster Constabulary, which was the police, to something that was a bit. They wanted to make it much more inclusive. So they were like, "Oh, what's the police service? Police service." So we're in Northern Ireland. We'll call it the Northern Ireland Police Service, and it was the Northern Ireland Police Service for a little while until someone went, and now it's the Police Service of Northern Ireland.
Very good. Yeah. So we hate acronyms, but we love it when something funny happens. I think that's the point that you and I are both trying to make. But anyway, Dix has not yet happened.
Okay, a big thank you to Claire for joining us on the Oral Apothecary, for sharing her stories, her medicine for the formulary, her career anthem, and her book for the Oral Apothecary Library. Look, that's it for Series 4. Thanks to all our guests who joined us over the last few months. Thanks once again to the team behind the team, in particular Claire Howard and Jonathan Underhill. Thanks to you, the listener. We know you're listening from all over the globe. As always, thank you for your time, support, feedback, and encouragement. We'll be back with Series 5 early in 2023 with perhaps a bit more of a patient-focused series for you. If you'd like to input any ideas or suggestions for Series 5, then we'd love to hear from you. You can contact us via Twitter at Oral Apothecary. We're on LinkedIn. You can email us at oralapothecarypod@gmail.com. For the final time this series, over to Gimmo for the final ingredient.
Okay, thank you, Claire. That was fabulous. That was amazing. So we're always looking for non-medical interventions here on the Oral Apothecary, but what about using our sense of smell? So a Scottish woman who found she could detect Parkinson's through smell has inspired scientists to develop a swab test that could be used to diagnose it. So this is from the BBC. Researchers in Manchester have created a new method which they say can detect the disease in 3 minutes. The work was inspired by Joy Milne, a retired nurse from Perth, and she knew her husband Les had Parkinson's more than 12 years before he was diagnosed, when she identified a change in the way he smelled. She said he had this musty, rather unpleasant smell, especially around his shoulders and the back of his neck, and his skin had definitely changed. She only linked the odour to the disease after Les was diagnosed, and they met people at a Parkinson's support group where she noticed lots of other people smelling the same. Les sadly died in June 2015, but a team in Manchester has developed a skin swab, which they claim is an accurate test to tell whether people have got Parkinson's. I'm not sure that's been fully tested yet, but that's what they're saying in the article. But what other diseases can we smell? So a very unscientific search of the internet has turned up 10 things that we can smell. So does anyone want to guess?
Cancer.
Cancer's sort of on the list. They've got dogs that have identified cancer, haven't they? So that was on the list, yeah.
Maple syrup disease?
Yes, top marks. That's on the list. Maple syrup urine disease. Go on.
There you go.
One of these is in your field of interest. Migraines was on the list.
Oh.
Diabetes ketoacidosis.
Diabetes insipidus?
It's not on the list, no. So not to say it's not true. Arsenic poisoning, phenylketonuria, typhoid fever apparently smells like people smell like freshly baked bread, narcolepsy, bacterial infections, and schizophrenia. So there we go.
What about asparagus?
I'm not claiming any of these are backed up by evidence, but finally, my big nose might come in for something useful after all.
This was a 3 Apothecaries production. Sound engineer Jimbo Slough. Original music Jamie Brewster. Artwork by David Baker.
Thanks for listening to the Oral Apothecary podcast. Caution, you may spontaneously combust if you take it too literally.
This episode of the Oral Apothecary is sponsored by jamiehayes.co.uk.